welcome. I'm honored to announce that Voluson Ultrasound has turned 20 and we cannot contain our excitement. This journey has been a legacy of innovation and patient impact that began 20 years ago when Voluson Women's Health Ultrasound joined the GE family. Working with you and other physicians around the world, we have improved women's lives and ensured better health for generations. Voluson is known for its innovative technologies and easy workflows. It is also a global market leader in women's health ultrasound, thanks to your love, support, and partnership. To celebrate this anniversary, we have created a web series called The Voice of Voluson, which recognizes the change makers in women's health in South Asia. Follow these stories of remarkable physicians who transformed care and inspired us to always aim higher, be bolder, and think bigger. Today we have one such change maker with us, and he needs no introduction. One of the most learned and much loved ultrasound expert in India and around the world. In today's episode, we will join Dr. Ashok Khurana as he reminisces his journey in the medical field, his initial days spent at AIIMS, and how he met ultrasound and then never looked back. Dr. Khurana will share the evolution of ultrasound technology to diagnose simple and complex cases, and talk about the exciting future ahead with technology advancements enabled by the Voluson Expert Series BT21, which is setting up a new standard of excellence in patient care. What's more, this will be your great opportunity to learn some interesting and fun facts about Dr. Khurana, to get to know him better. Let the celebrations begin.
I never planned it. I never aimed for it. I was born with a photographic memory which I used for my examinations, and so I always got good grades. And if you got good grades in my time, you at a very young age were pushed into a class which had biology and mathematics. And I told myself, look, I want to be an architect, I want to be an artist, I want to do English literature, I want to do theatre. And here I am getting stuck with this just because I have a photographic memory. But destiny was destiny. I got into the All India Institute of Medical Sciences, and I was very thrilled, and I said, okay, now I will become a doctor. But then I wasn't so sure I wanted to be with patients. I figured I will do either laboratory sciences or maybe radiology. And I decided to take up radiology because it was all only conventional radiology at that time, X-rays, and we could happily sit in our offices and enjoy our coffee and perhaps air conditioning, which was not so common those days. And so I took up my post-graduation in radiology at the All India Institute of Medical Sciences, purely because I thought I will not be patient-centric. And then ultrasound came along and I said, oh my God, now what do I do? I loved it. I loved the challenge of ultrasound. So ultrasound for me started very early. It was very early 1980, and we got a donation of a machine from the United Nations to the All India Institute of Medical Sciences in the gynecology department, and it was a bistable machine, as we call it. No grayscale, black and white. There was a mechanical sector that you had to move all over the patient, and it built up things nicely. And it gave us an idea. So I spoke to my head of the department of radiology, Professor Sneh Bhargav, and I told her, I said, ma'am, we must get this for the radiology department as a proper machine, because this is an old machine and we moved on to real time and grayscale. So she says, okay, if you say so, then let me look around. She called me to her office after 3 days and she said, it's very expensive. I said, yes, but it's cheaper than a CT scanner. It gives us more information on the abdomen. 90% of our problems are abdominal and gynecological and pregnancy. So let's get hold of one. And she was very kind. She says, okay, we'll buy one. And that's when the fun began, 1980. And then we moved on to a better real time, a better grayscale, and then Doppler came along. That was the early 80s again, 1982, 83 beginning, and it was fantastic. It was really very nice. It was black and white, but we used to get great signals. And with that, we said, all right, we're all set now for flow information and not just anatomy information. And then we moved on to color. There was color in the early 90s, 1991. I picked up my first color Doppler, fabulous. Localization of a vessel was fantastic. The waveforms were fantastic. We didn't know what the waveforms meant for many of the areas. We didn't know what a triphasic truly meant, but we used to do a pretty good job of trying to figure out, and we learned by ourselves because there wasn't much in terms of information on that so far, and internet was still in its ancient days. And then 1999 came 3D, and it was a Voluson, the 530D, and I said, wow, that's a dream come true. But I didn't realize in those days that it takes about 45 minutes to make a face, and we had no cross-sectional 3D. It was pure surface rendering. And so we said, all right, pure surface rendering or not, we do that, and we got some really nice faces. So GE partnered with Voluson at the turn of the century, and they walked in one day. My machine had just broken down. My Voluson 530D had just broken down in the sensor. Don't worry, we've taken this over. And then suddenly they said, no, we have a new machine for you, the Voluson 700. And I said, wow, isn't that fantastic? And they said, we'll give you 1 day downtime and everything will be sorted. A much faster machine. The faces came out so nicely. We got some orthogonal planes, which we had barely ever seen before, and they worked very nicely. There was a fairly decent resolution in the C-plane as well, and we were really pleased. There was this fantastic onset of a new era. And then, of course, we've never had to look back ever since. One Voluson after the other Voluson. Like I always say, ultrasound is Voluson, and Voluson is ultrasound. I'm so pleased for the last 20 years with the kind of satisfaction imaging with the Voluson has given me in my day-to-day practice. Voluson hasn't partnered with me. I haven't partnered with Voluson. We've partnered together. So I didn't realize that there was going to be a brand. I didn't realize that it would be something I would learn to love. It would be part of my everyday life. But I suddenly realized that I was Volusoning all day long. I wasn't doing ultrasound scans, I was Volusoning. And it changed everything because we had already moved on. By the time it was 2002, I had a book which came out on 3D and 4D ultrasound. We had all the new wonderful machines. We even had an idea of how the scan times had gone down. And then, of course, we realized that you could add on color. We realized very soon that there was automation. There was the stick came along, and we were so excited. And then, of course, the leaps. 3 thrill of technology and the thrill on your patient's face when they saw a face, the baby's face. And the thrill that your clinicians would come back to you and say it looked exactly like this. Not the baby face, but the inside. The surgical anatomy looked exactly as you showed us on your 3D sections. And you know that CT type picture they used to say, yes, TY. It's fabulous. It was exactly like that. And I knew I had to go 7 centimeters deeper and I would get this answer. And then a surgeon told me I went 4 millimeters deeper and I found that foreign body sitting in the myometrium, and I said, wow, 4 millimeters accuracy by localizing it on a tomographic ultrasound imaging and a few measurements here and there on the orthogonal plates. It worked well. And OmniView came. When OmniView came, I was the happiest. I was also very happy when faster speeds came along. I was thrilled when Radiant Flow came, because Radiant Flow changed the texture of things. It changed my thinking, because then everything was fantastic. And then, you know, there had been a minimum compromise when we used to shift over to color and use it along with grayscale, and then it changed. And then it also changed because we got even better grayscale than ever before. When I got my C2-9, I said, wow. I was anyway only using volume transducers. I wasn't using my routine transducers. It came and I changed my practice. And then this year comes along the RM7 CNS. Isn't that fantastic? I go back to using a single transducer for everything except my vaginal scans. And I have the most fabulous 2D. I have great resolution at depth. I have really cool acquisition in all the combined modes. I have great light edits. I work on a wonderful HD Live Studio. The automation has been fabulous. I didn't ever think that we'd be using OmniView for doing Sono CNS, but it happened. I saw Sono VCAD change. We presented our first paper at ISWOG in Chicago many years ago, and then it was an idea ahead of its time. It wasn't well received, but today look at Sono VCAD. 2 dots and you're sorted. You get every single section just like that. And then we realized that working with Oxford, we were sending them images and they were doing automation, and it was on to the Swift in no time. It was fabulous. You are scanning and the machine recognizes that this is a tangential view of the face. This is your BPD plane. This is this view. This is that view. And it works and it measures and it's automatic and it's light and it's fast and it does everything for you. I mean, that's good technology. It's been a grand ride, and I'm so glad it's still going strong, and there's been no compromise on the grandness of volutioning from morning to night. One of the greatest leaps forward in ultrasound has been evaluation of the fetal heart. Along with evaluation of the fetal brain, we've had some tremendous advances in evaluation of the fetal heart. Fetal echocardiography used to be so complex until volume imaging came along. When volume imaging came along, I had to go to an area I didn't understand. I didn't know where this was located. I didn't realize in which part of the heart this was located. I didn't realize which vessel things were in. And I put my reference dot and I said, wow, this is a cord triatriatum. It was one of my earliest cases when we started stick, and I said, isn't that fabulous? And there's been no looking back since then. When we started doing stick with color, when we started doing stick with B-flow, we were getting fabulous results. And then now, of course, Radiant Flow, we've realized that HD Live is completely altering everything. When silhouette mode came along with silhouette color, we could see everything right through. So there is no complexity left in fetal echocardiography. We use stick as a tool for learning about the fetal structure in terms of the heart. We now use stick for a diagnosis of abnormalities of the fetal heart. and a combination of the two to now finally say, yes, my dear surgeon, this is what you're going to find. Yes, my doctor in that area tells me that this is a disaster and I'm not sure we should prognosticate this patient in any favorable way. Fetal cardiac surgery is not very popular because of the complexities and because of the late diagnosis, but the kind of prognostication we've given to neonatal cardiac evaluation, neonatal cardiac prognosis has been tremendous, and it's all been because of STIC and its understanding. The more you use it, the more fabulous it becomes. The more surfaces you render, the easier it becomes, and the more transparent the heart becomes with silhouette, the simpler it becomes for everybody to understand what the disordered structure is, and importantly, what the disordered physiology is. A pleasure indeed to work with clinicians now, because they keep giving us compliments, they thank us for this, and our patients come back to us and say, yes, my child is no longer an abortus. It's not something we dropped because there was no hope. You give us hope. You give us a surgeon. We went to the surgeon. We had faith in the system, and Voluson has given us a baby today that's completely capable of great normal survival and going to a normal school. That is indeed very satisfying. And real time came along and you could see things, and I kept looking at this thing in 2D, kept looking at this fetus, it won't move, and I said, what do I do? And this was way back 2004. There was a bit of polyamnios, and I said, I should get a good 3D, I should get a good 4D. I switched on 4D and I realized, oh my god, these are extension deformities. I had no idea that something like this was going to be happening in fetal legs. We've seen flexion deformities, we've seen arthrogryposis, multiplex congenita in its various forms, but I'd never seen new laxova. And I said, wow, I see this fetus, the legs are like this, absolutely fixed extension, and then the foot going in the wrong direction like that, and both the legs are like that. And I said, okay, new laxova. Fantastic diagnosis. It worked correctly. It was proven post termination of that pregnancy because the patient didn't want to carry on. And I said, wow, that mother had had a very bad obstetric history, but she even had a worse family history. She had several disabilities in her family, and we don't know why. They weren't connected with the new laxova, but she had those, and they didn't want another disabled child in the family. And I understood that day what a good diagnosis means. We try to give every fetus an optimal outcome, but we also try to give every family an optimal outcome. And Voluson helps me to give every family an optimal outcome. I remember also one more case, and it was a very difficult fetus because there was a bit of oligoamnios, and they were wondering in Hyderabad on how they should try and improve the outcome of that hypoplastic left heart. And I said, look, we're not going to be able to puncture this unless and until this fetus points anteriorly. And we waited half a day till the fetus pointed anteriorly, got a good image, and went ahead with the process. But the fact is that that patient waiting, the fact that I could prove to the surgeons that, look, in any technology, stick or no stick, color or no stick, combination or no combination, there is no way you're going to be able to see anything once the guide wire and the catheter are in the heart, and I have to have the heart pointing anteriorly. There is no way we can have any other approach, because we cannot direct this into the fetal aorta if we don't go into the left ventricle at the correct angle. And it worked. And so then I said, okay, we will make sure that from the simplest function of the Voluson, which is great 2D imaging, to the most complex function, we will continue to use it always. Thank you very much, GE. The past year and a half have perhaps been the most difficult for mankind, psychologically as well as in terms of disease, than any other era in history. But during this time, GE was at work and producing technology for us that has given us the RM7C and the Voluson BT21. I so greatly appreciate that. It's not easy to work in COVID times. It's certainly not easy to work constructively in COVID times, and many of us have not been able to cope with it. But this group has worked. There's been feedback and they worked harder. There's been more feedback and they said, we'll come back to you, and they've come back to you without taking a year and a half. They said, we'll give it to you during COVID times. And we now have this brilliant machine that works. Keep up that. It's wonderful. It transcends basic humanity and takes you to the level of the divine. Truly grateful to the engineering at Austria and GE for bringing us this technology in spite of these absolutely horrid times. Holidays, annual meetings, and teaching exercises. So my most favorite way of relaxing, truly speaking, apart from sitting and thinking nothing and doing nothing on a holiday, is to teach hectically on a weekend. To travel to a teaching place where I have a group of students or delegates or attendees or a congress and speak there. So I have Voluson as a partner with me on weekends too, and that is how I relax. Not 40 view, I don't sit with that alone in a room, but sharing knowledge and giving good diagnosis with other people is one of my most favorite weekend activities, and it's always been. And now, because we've learned the virtual world, I now share the world of Voluson with my attendees at web-based teaching programs, webinars, and that's truly relaxing as well. So it's a question of partnering at a professional level, at a patient level, and at a relaxation level. That's something I enjoy doing, which is teaching and sharing with my students. I was born an actor, so I was almost born on the backseat of a car, because when my mother was going to have her first baby, it took her 24 hours. When I was born, it took her 3 hours, and my mother swore I came out smiling, and I was on the stage since then.